Thank you. I appreciate the framing and the remarks by Tom and Mike. That was a brilliant framing and introduction to what we're going to be talking about this afternoon. And so, as was mentioned, so my name is Catherine Bertram, and I'm the Senior Social Behavior Change Advisor. I'm with Johns Hopkins Center for Communication Programs, also with the READY Initiative. Also presenting today will be Carla Sanchez, and she's the Senior Social Behavior Change Specialist with Save the Children, and she's also on the READY Initiative. So, like everybody else, I am working from home, so I just want to apologize in advance if somebody's, bursts in the room asking for a misplaced sock or something like that. Hopefully that won't happen, but apologies in advance if it does. So let's just go ahead, and I want to start by just giving a brief introduction to what social behavior change is, what risk communication and community engagement are, so that we're all on the same page. And some of you may have participated in the READY Outbreak Preparedness Planning Workshop that the READY Initiative held recently. And so apologies if some of this information will be repeated to you, but I just want to make sure that everybody's going to be on the same page. But then we're going to go into more contextualizing this information related to Save the Children's framework for COVID-19. For community engagement specifically. Some of you may not be on mute, so if you can put yourselves on mute, that would be great. Okay, so then I just want to start by just describing a little bit what social behavior change is. So we really describe it as the intentional process that seeks to understand and facilitate change in behaviors, social norms, and the contexts that drive them. And so what we generally tend to do is look at what is happening around individuals because that matters as much as what people themselves think, and which can also be biased. So we look at those behavioral drivers at all different levels, at the individual level, looking at those individual knowledge, skills, beliefs, values, habits, and so on. But also the influences at the family and peer and community level and the social and structural level, which can include everything from policies and religious and cultural values and so on. And so what it really comes down to is that, people are complicated and they generally just don't consider the pros and cons to making a rational decision on the best path of action. So providing them with the right information rarely automatically translates to a logical choice. So when we unpack the behavioral drivers at each of those levels that I described, those individual, psychological, social, and structural levels, we just see how complex human behaviors are. People are also emotional. They have habits. Basically their demographics, whether or not they're single or married, have children, their age, their gender. All these things matter in terms of how they make decisions, in addition to the knowledge and the skills that they have. People are also influenced by their context, and particularly in emergencies. Whether or not what their perception of risk is, and how that influences the decisions that they make. Whether or not people are stigmatized and how that affects the decisions that they make, whether or not to even seek care or hide their illnesses because they fear being stigmatized, particularly in an emergency situation. People are influenced by social norms, so their perceptions of what their peers believe about a behavior and what they see their peers actually doing, and how accepted they may feel within this context. Their access to health services and whether or not they trust those health services will influence a person's decision. Their built environment and the community structures have a big effect on people's decision-making ability and whether or not they adopt certain behaviors. And not just the built environment, but all of the policies and all of those structures within their community. Their cultural beliefs and their religious beliefs. And people tend to hold on to their cultural and religious beliefs even more so in an emergency when they're feeling threatened and at risk. And so the key to designing effective social behavior change programs is really an understanding of those elements that influence a person's decisions and actions, and then implementing behavior change interventions through a variety of different processes and interventions, depending on what is needed. So from community engagement to interpersonal communication between service providers and clients, mass media, we look at incentives, different motivators, and so on. And we'll talk a little bit more in depth about community engagement in particular in a few slides and a little bit later. So now I just want to describe a little bit about what risk communication is specifically. So according to WHO, risk communication is the exchange of real-time information, advice, and opinions between experts and the people facing threats to their health and their economic or social well-being. So the purpose is to enable people at risk to take informed decisions, decisions about mitigating the effects of that threat so that they can take protective and preventative actions to protect themselves and their loved ones. And so we need information and engagement, decision-making by those at risk, and we need them to take action. So to know about a risk is really not enough, but to take action to reduce that risk or risk reduction is really key. And so there were some studies done in the 70s and 80s on the perception of risk. And so in short, I just want to say that based on those studies, we are less concerned about health risks that are voluntary. So we choose to take those risks that are familiar to us, that are controllable and controlled by self, so we have control over those risks, that are fair, so they're not singling out a particular group, that are endemic, so not those sudden epidemics and sudden emergencies, and that are not fatal. Conversely, we're more concerned about health risks that are involuntary, so that they're imposed on us. They're unfamiliar to us. We don't feel as much in control about mitigating those threats. They're epidemic and sudden. They're grouped by time and location and fatal. And so when we have an idea of what the perception of those risks are, we can really look at them in terms of how we can construct messages. And so the extended parallel process model is one that we use in risk communication. And it really states that for individuals to take protective actions, they must feel threatened by the consequences of a behavior and feel able to act to avoid that threat and believe that the action is effective. And so what happens is that based on this model, we can see that if the perception of threat is really high, but people don't feel confident enough to be able to take actions, or that they don't feel like those actions will be effective, then they may just reject those messages, but because what they're doing is controlling their own fear rather than controlling the danger. Similarly, if they're not feeling enough threat, then they may just disregard those messages outright, even if they have the confidence to be able to take action. And so just as an illustration of this, this was basically a Facebook post from a friend of mine who's not in public health, but is a software engineer. And I just thought that it was an interesting illustration of, or a perfect illustration of kind of that balance between a perception of threat and also her self-efficacy or confidence to be able to take action. So when I saw this, and this was, I don't know if many of you know, but in the United States, in Washington State, it's a particularly hotspot area for the COVID-19 outbreak, and it was one of the first states that that really had the largest outbreak, number of cases and deaths. And so the county in which she lives in did a really nice job in terms of providing risk communication to the community. And so when I saw this post, I asked myself, was she reflecting on, can this happen to me? Am I susceptible to this disease? Is it bad? So what was her perception of that severity? Is there an effective solution that I can do? So washing hands, cleaning surfaces. Am I able to do that solution? And so, again, it's just more of an illustration of the balance between that perceived threat and that perceived self-efficacy. Conversely, during the early stages of the Ebola outbreak in 2014, 2016, we really saw, so risk communication, community engagement, social behavior change, it was under prioritized in those early stages. There were not a lot of resources and a lot of efforts going into that in the early days. And so what happened was you had a lot of the response organizations, agencies, and efforts in general that was trying to increase the threat of Ebola. And so you had a lot of messages that were going out saying Ebola kills, there's no vaccine, there's no cure, and so on. And so people were trying to increase that threat level, but without sort of the same level of effort around actions that people can take. And so what happened was you had this increase of fear, and also people didn't feel like if they got sick or if one of their loved ones got sick, that there was no incentive for them to actually do anything about it, to take them to an Ebola treatment unit. Because why do that if there's no treatment and there's no cure? And so, in short, I mean, this was a real turning point for risk communication and community engagement in disease outbreaks. And there were a lot of lessons learned that came from that outbreak. And it was a real turning point for how we respond, especially with risk communication and community engagement. And so a lot of organizations, including the WHO, really started to rethink how they do business. And so one of the main things that that really came out of this was that risk communication really requires having a structure in place. And so that means people, resources, investments, and so on. And importantly, that risk communication and community engagement needs to be coordinated across all partners to ensure that messages and that actions are coordinated. And so there's not a lot of scrambling on the ground. And critically, that there is community engagement that is not just a top-down approach, but that is two-way communication with dynamic listening, and that is addressing the perceptions and the rumors and the behavioral risks. And so I just want to touch a little bit here on rumors and misinformation, which are really key in an emergency situation. And so, sorry. And so the motivations for creating, sharing, and amplifying rumors may vary from something as simple as trying to be helpful to needing to feel a sense of control in stressful times, to wanting to position oneself as being in the know or even intentionally misleading. So whatever the motivations may be, rumors may thrive when there is less certainty about an issue. Rumors are also a social barometer that can give us insight into how people are thinking or feeling about COVID-19. So we can't ignore them. There's too many instances where a rumor could really be disrupted to an entire response. And one example was in northern Nigeria with the polio immunization program, where the responders were not really listening to and addressing some of the rumors around vaccination, which really stopped people from vaccinating their children in the outbreak. And this resulted in the need for a response cost of more than $500 million in addition to those costs for the response. And so listening to those rumors and addressing those rumors is also really critical in a risk communication approach. And so as we know for COVID-19, there's a lot of examples of rumors that are being circulated. And I'm sure within your own programs in your own countries, you're seeing a lot of these rumors already. And so there are some global guidance that have been developed already around addressing rumors and misinformation. One of which, importantly, is to identify ways to detect and track misinformation and being sure that we can refute that with evidence-based facts. Respond to ongoing questions through channels that community members use frequently. So those healthcare workers, for example. Ensuring that we have two-way channels for sharing information, such as hotlines or social media, call-in radio shows. And we can use FAQs to steer our risk communication and community engagement response. Importantly, we need to make sure that we're pre-testing our messages with members of the target population and that we're offering those messages in multiple languages and in multiple formats. We need to ensure that we're sharing with partners and other amplifiers to ensure a broader reach and consistency. So if we're getting some of that community feedback and we're observing some of those rumors within our own programs, we need to make sure that there's and there usually is now, every country or region has a risk communication, community engagement coordination mechanism. So feeding that back into that mechanism so that we can amplify the response is important. And engaging media to understanding the narratives, angles, changing science and coverage. So I want to talk a little bit about stigma, which is also a key area, particularly for the COVID-19 risk communication, community engagement response. So why is there so much stigma related to COVID-19? So usually stigma results from a lack of understanding or access to information that can cause fear or panic among individuals, leading to irrational assumptions and the need to blame others. So, you know, we've seen it. This can lead to harmful stereotypes and racism. And what this, and just as an example of some of the things that I've observed, and this was even just on the flight home from when we were out doing the outbreak preparedness planning workshops in Asia. I was flipping through the newspaper, and you know, some of the things that I've even noticed just doing that, labeling the outbreak or the virus to a particular area really creates stigma for that area. So like in Korea, They were labeling the virus as the Daegu virus because in South Korea, the outbreak was shown to start in that particular area of South Korea. So this also creates stigma among those community members in that area. As well, we need to be really careful about the language we use, using language like super spreaders, referring to people who have the disease in derogatory ways is really, we need to really be careful of how we're using language in this COVID outbreak, as well as really ensuring that we're observing and responding to the language that we hear, so that we're not exacerbating and that we're addressing stigma that we observed. Why is this important? Because stigma can drive people to hide the illness to avoid discrimination. They refrain from seeking health care immediately. It prevents people from adopting healthy behaviors. So there's a real public health interest in addressing impact, aside from it being addressing stigma, aside from it being really the right thing to do. I talked a little bit about how language is important, but we also can do other things to address stigma, like accelerating fact-based information. We can do that through a variety of means on media, websites, hotlines, for example. We could showcase positive deviance. So in other words, those communities or individuals who welcome group interaction with stigmatized groups, so we can promote that. We can promote recovery stories, and I've seen this happening in different countries where people who have been affected by COVID-19 or are recovering from COVID-19 are being promoted in a positive light and coming back into those communities. We can create opportunities for stigmatized groups to interact with unaffected groups, and this has been shown to be effective in gaining an understanding and reducing stigma. And importantly, there are organizations and initiatives, probably in most countries, that are addressing stigma and stereotyping. So linking up with those initiatives to really create a movement around this, showing care and empathy for all. And so now I just want to give a little bit of overview of community engagement. I wanted to talk about rumors and stigma because I think that these are really important considerations for community engagement as we're addressing COVID-19. So just again, so that we're on the same page for how we're describing community engagement, it is a process, and it's a process of working collaboratively with groups of people affiliated by geographic proximity, but also special interests with respect to different issues affecting well-being. So through community engagement, you could really advance COVID-19 preparedness, planning and response. And you could do this assisted by public health and community partners. And this may include healthcare, people from within healthcare facilities, pharmacies, educational institution, local businesses, and including organizations that and community members of different groups that may be high risk during a pandemic. So children, the elderly, individuals with disabilities, and so on. Importantly, communities must be at the heart of any public health intervention, particularly in an emergency. So engaging communities in a dialogue about COVID-19 readiness. And as a start to this, it would be important to look at conducting a needs assessment to gather information about knowledge, attitudes, and beliefs and challenges related to COVID-19. But also working closely with communities to address some of those challenges and support them in identifying solutions And Carla will talk a little bit about how to do that in your programs. And so this illustration really illustrates a more equitable relationship between responders and the communities. So particularly on that far end of the spectrum. So we really want to get from a place of one-way communication and informing communities about what they can do to really collaborating and partnering with them and empowering them. So creating opportunities for that two-way dialogue with affected community members really enables a better response, and it empowers them to give feedback and participate, and ensuring that the response is based on the needs and the capacities and the opinions of all of the people affected. And this really helps to ensure that that we're more responsive to the changing health priorities. And so there are some fundamental principles for community engagement. There was a partner-driven process that took actually several years that was led by UNICEF C4D, but many organizations participated in the development of principles and standards and indicators for community engagement, including Save the Children. And so I'll just go over some of these. So the fundamental principles that have been defined are, ensuring that community engagement is based on a human rights approach, so that we're expanding equity and empowerment, and that it's a community-based approach, so that we're supporting people of all genders and all ages to express their needs and to decide their own future with a view to their empowerment. And this really requires recognition that they are meaningful participants in the decision making, and that doesn't always happen, and it really needs to, and we really need to make sure it does. Accountability, so that we're accountable to those local populations for their actions and priorities, and resource allocation. Gender, making sure that gender mainstreaming is a part of our community engagement, so that there's a gendered analysis and those gendered perspectives and attention are included in all activities. Importantly, particularly for Save the Children, that the best interests of the child is a primary consideration, and that, of course, that we're doing no harm. So those are the fundamental principles, as well that the quality standards and indicators have some core minimum standards that have been identified. And I'll just go over some of these really quickly as well. Participation, we've talked about that, ensuring that communities, assess their own needs, participate in the analysis, planning, design, implementation, monitoring, governance, all of that in terms of their own needs and solutions. Empowerment, so that this is both a process and an outcome of community engagement and participatory process. So making sure that those community members are empowered to act. Inclusion, ensuring that those who are underrepresented, disadvantaged, vulnerable, marginalized are identified and supported and ensured of a role and a voice in community engagement. Two-way communication, that communities both give and receive clear and appropriate and accurate information. Ensuring that community engagement can adapt to new circumstances and particularly are localized. And that we're really building on the existing skills and resources of the community. So these are the core standards that have been identified and really need to be a part of all of our community engagement design and programming. So, but what does this mean in a COVID-19 pandemic, particularly when social distancing is a critical measure? So many of you may be familiar with the non-pharmaceutical interventions that WHO has identified around hand hygiene, respiratory etiquette, some of these areas around social distancing, surface cleaning, and so on. And so there's been these non-pharmaceutical interventions that have been sort of at the heart of some of the messages that we've been relaying to community members. There are other guidance in place around home-based care and how we should isolate the sick who are at home if they're not exhibiting severe symptoms. But consider, there are communities that have overcrowding in their homes. They have maybe small housing and large families. Children may be home from school, and that causes all sorts of potential complications. There may be inadequate or limited access to health facilities or access to soap, water, and supplies, like face masks, which are one of the recommendations, hand sanitizer, and some of those cleaners. There may be resistance to staying home from work if it means loss of needed pay. And then, all those cultural and social norms that we talked about, as related to like communal eating or religious and spiritual practices and so on, where mass gatherings are important. And so I want to relate this now to Save the Children's program framework and guidance. So how do we do this in the context of Save the Children's guidance and framework? So I was looking through the framework and I saw basically some of the top line intervention guidance for risk communication and community engagement. And I'll just run through some of these really quickly. The ones that have been identified are around coordination and collaboration, understanding the behavioral context, so looking at the collection of, looking at those behavioral barriers and facilitators, prioritizing key behaviors, doing a mapping of those existing SBC channels at the community level, for example. Ensuring proper community entry and local leader advocacy, so that community engagement piece, including child-friendly and gender-inclusive key messages and materials, looking at those rumors and misinformation, and importantly, looking at those technology platforms, especially important, again, considering those social distancing measures. So this is just sort of an overview summary of some of the things that you all have identified within your framework. Similarly, I also looked at some of the sample humanitarian actions that related specifically to social behavior change, risk communication, and community engagement within your framework. And what I really saw around that was basically all of those different interventions really need to involve some understanding of the perceptions, of the rumors, misinformation, behavioral barriers, facilitators to taking action, right? And that there's some level of community engagement and some level of messaging in all of these different sectors. As well as, we've identified the importance of working with different community groups, vulnerable and marginalized populations, women's groups, and other change agents as well. So those community leaders, those traditional healers, and those community health volunteers. And these recommendations also involve joint decision-making with the communities themselves. So decisions related to like hand washing stations, for example, cash transfers, food security and nutrition. And then importantly, supporting children in those communities and considering the mental health and psychosocial support needs of the communities and particularly children. And so I'm just I'm just summarizing what you have in this framework so that we can have just a little bit of a framing for how we're going to talk about community engagement as it relates to adapting some of your programming to ensure that the adaptation is accepted at the community level, and that you may mitigate any sort of backlash or reticence if programming needs to be halted or reactivated later on. So these are important considerations for us now. And so I'm going to kind of just go over some basic actions for community engagement. These are sort of applied across all of the community engagement approaches. This comes from global guidance on community engagement specifically for COVID-19. So we need to ensure that we're enabling engagement before, during, and after the epidemic, that we're focusing on adoption based on community feedback, behavioral and social evidence aligned with the country context, that we're identifying those networks of trusted key influencers. So all of those school systems, faith-based organizations, women's networks, and so on. That we're including stigma and discrimination prevention in those interventions. And that we're preparing other response actors as well for guidance, those epidemiologists and so on, other healthcare workers. So at this point, I want to turn it over to Carla Sanchez, who's going to be leading you through the community engagement process that you should consider for your programming. Carla?
I hope you can hear me. I'm sure if you cannot, I will get a message or a comment about that. So thanks, Catherine. And just to repeat, I'm Carla Sanchez. I am on the Behavior Change and Community Health team at Save US. So we wanted to kind of present with you some actual concrete kind of steps to kind of commence your community engagement around COVID-19. And, you know, we have a main kind of approach that we at Save the Children use, which I think a lot of you might be familiar with, which is the community action cycle. And so what we've kind of done is done some literature and taken this community action cycle and kind of distilled it a little bit for this response. So we started with so step one would be to meet with municipal and district leaders or district leaders for their buy-in, support, and to help you identify and advocate with community level leaders. And, you know, this is kind of your first step. This is your entry to the community leaders. And this is important because they will help you to kind of make that connection and to also ensure that they're kind of pushing for you as well. And many of you may have already done this step. And if you are, great. You're already a step ahead of the game. Catherine, would you next, please? And so when you are meeting with them, ideally you would do this face-to-face, and you would explain your goals for working with communities. For example, you would be adapting your programming to the COVID-19. This is where you would get the names, contact info, and then other information around these communities like geographic coverage, village level connections, etc. They would also, so this, like I mentioned before, these these municipal and or district leaders would also be there to encourage community leaders to participate and engage with you. It's kind of like a let's work together on this. Yep. And so again, the F2F is the face-to-face question mark. So is it possible to meet with these leaders face-to-face? Hopefully, if this happens within the next few weeks for you, it could still be possible to meet face-to-face. And just to kind of emphasize that, you know, ideally this would all happen face-to-face, but we're not dealing with ideal situations right now. So whenever possible, let's try face-to-face, but we have to start thinking about other options when that's not possible. Step 2. So afterwards, we would be reaching out to community level leaders for community entry and to facilitate and support community engagement. And it would be here where we would orient leaders and gain their buy-in and support. In the meantime, again, municipal and district leaders could continue to encourage the community level leader support and buy-in. And we have to consider, again, mobile technology, or mobile or other technologies to engage these leaders, to build relationships with them if face-to-face isn't possible. So it will be more of a challenge, but it is still possible, I believe. Next. All right, so this third step would be to conduct a rapid assessment to understand as much as you can with the limited time, resources, et cetera, about the communities that you're going to be working in. Sorry, what I'm missing to mention here is kind of who would be doing this. So this would be kind of Save the Children at this phase still, at this step still. And you can do this by gathering health HMIS data, phone interviews with local leaders, health service providers, government officials, local NGOs, community health workers, and volunteers, et cetera. And we do have a tool available to help you kind of do this process. The next step would be to orient the community themselves, and this is the broader community, on the situation, on the community engagement activities that you hope to work with them together on, for their buy-in and support, and also to identify those key community members, and I'm going to call them here community groups, to drive these community engagement activities. And again, this would be with Save the Children and community level leaders. And again, we have to consider certain technologies like interactive community radio, WhatsApp, Facebook Live, et cetera. And, you know, this might not be just a one-off kind of discussion with broader community members. You might have to segment different community groups. You might have to use varied or mixed methods. So maybe community radio to reach certain populations, maybe WhatsApp or Facebook Live to reach other segments of the population. But again, the goal here is to kind of share this information with the broader community. And community leaders can help ensure that key community members are included in this. A lot of times vulnerable groups are kind of left off or forgotten. And so it's important to ensure that they are part of this discussion and orientation. And it's also important to include kind of key influencers and leaders like religious leaders, women groups, youth group, traditional leaders, et cetera. And it's important to do that to have this kind of fuller representation of the community. And then once we have this kind of community members, this community group identified, we would train them on basic, I have here, social media platforms. We would train them using social media platforms, but we would essentially train them on the next steps that we're going to talk about. Next, please. So step 5, we would facilitate community level assessment, mapping, and some planning. So this community group, with the support of Save the Children, would map community resources and vulnerabilities. For example, what essential services there are in the community, food, water sources, where your health service providers are, your community health workers or volunteers. Identify some vulnerabilities like your vulnerable groups, like for example, orphanages or where the elderly homes. Identify areas with potential risk for outbreak, like markets, slums, et cetera. And then this would be driven by the community group as well. And then Save the Children with the community groups would drive community level assessment on behavioral facilitators and barriers to adopting COVID-19 prevention behaviors. So this would be capped by phone surveys, for example, and we could engage Viamo, possibly, or we could look into other resources that are available. And this would be done with district health nurses, community leaders, et cetera. Traditionally, this would be a more community-driven approach, like face-to-face with a community meeting with members of the community. But considering the time limitations on the face-to-face, I think that this data and this information would need to come from Save the Children, from this CAP, and presented back to the communities for their kind of validation. Next, please. And the next step would be to develop your plans, identify the activities, and to implement. And this would be driven by the community groups with the support of Save the Children. And this is where, again, the communities themselves would have to identify the best technology for them for remote engagement. So again, WhatsApp, Facebook Live, or other tools and resources that people use within their communities. And here's what we would, after kind of learning what the issues are at the community level, identify the actions to address these barriers and development of these community plans. And then the community group, again, with support by Save the Children, would drive these activities. So some examples could be the community has identified that there are not enough hand washing stations in certain areas of the community where they're really important. So these community groups, for example, could help to advocate with whoever is implementing these hand washing stations. It could be UNICEF, for example. And so that would be kind of one of the activities where it's like, let's collaborate, let's communicate, and let's ensure that these are being placed in the areas of the most need. Or there could be other activities like linking to existing initiatives, or if there is no funding, let's say from UNICEF, then maybe communities might be able to mobilize resources for other things that they need to adopt these preventive behaviors of COVID. So these are kind of really quickly, very distilled in a nutshell, steps that you could take. And we do have tools and resources that we have prepared draft versions of that we can share with you to provide more guidance.
Thanks so much.
Give it back to you, Catherine.
Yeah, thanks so much, Carla. Yeah, like Carla said, it's really a sort of in a nutshell approach, and we do have some tools available for everyone to look at and use. But I guess the question I want to ask is, given these approaches in this process, like and what we talked about before in terms of how each of you within your sectors identified specific areas that you want to focus on for COVID-19. How do you do that in a more integrated way, given these steps and the community engagement process? How do you mobilize some of those community change agents and different community groups to be able to look at some of these things together, whether it's food security, nutrition, WASH, and all of these different areas of needs, and working and partnering with the community to identify how they will address some of those needs, and working on an action plan with them, and ensuring that there are those community leads who are taking the initiative to make sure that those solutions are being implemented. So I just want to talk a little bit about technology for remote engagement. So this is a new space, I have to say. We, at the global level, the Risk Communication Community Engagement Working Group are trying to form right now a subgroup that will work specifically on guidance for remote community engagement. So those are under development, and I'm assuming that they will be available to all of you soon. And Carla and I both will make sure that you will get those guidelines once they're available. But we mentioned just a few things just in the course of these steps that I just want to maybe shine a little bit of light on in terms of some technologies that are being considered now for engagement, for rumor tracking, and so on. And so one of the things that we're looking at is adding rumor collection questions to pre-existing hotlines. So this is one way in which you can track and analyze rumors that are coming in through hotlines at the national level. So this is outside of your own community engagement processes, but if you're working with other partners, particularly through a risk communication community engagement coordination mechanism or working group, one of the things that you can consider is, leveraging existing hotlines for tracking some of those rumors. And there are some guidance available on how to do that. And you can incorporate some of those findings into your community engagement. Viamo was mentioned. Carla mentioned there's a platform called Viamo. This is basically, it's an application that I think is becoming popular in terms of how it can be used to connect with large groups of people. You can conduct phone surveys. It's very low bandwidth, and you are able to use it for different types of pushing out messages. And I think there's also a two-way platform as well. So these are some options that are also being considered. I think in particular, it's being used for sort of those online surveys and assessments. WhatsApp, and Facebook. These are other approaches that are being used for sort of two-way conversations that you can have with individuals or groups of people. And there will be some guidance around how to use WhatsApp and Facebook chats and other Facebook, I think, applications as well, to be able to conduct some of that remote community engagement. U-Report is another tool. This is something that UNICEF C4D has available. It's a free tool for community participation. It also has a survey application and a platform for direct messaging. Data can be segmented in different ways. I'm not an expert in U-Report, but if you have links to UNICEF C4D, I'm sure somebody there will be able to describe this a lot better than I can. But just letting you know that this is another option that has often been used. It was used in Ebola. I think it's even being used now for COVID-19. It's been activated in multiple countries. So I just wanted to go over those technologies as a starting place. I think a lot more needs to be done around that. What I didn't mention is that there's also options of using interactive radio programming, particularly interactive community radio programming, where you can have callers call in, you can have experts fielding those calls and responding to community concerns, and you can have interactive platforms that way, or interactive conversations that way as well. And that can feed in directly to your community engagement programming. And that's another area where we'll be offering some guidance. It's in development right now. So with that, I do want to point to that the READY initiative is developing a social behavior change risk communication community engagement toolkit. We have fast-tracked some of those tools where we saw that there were gaps at the global level. We've been feeding those to the global level risk communication community engagement working groups. But importantly, we've been sort of compiling those existing guidelines and tools so that they're in a easy to use sort of platform, so you can download those when you need them. So so I just wanted to go over this really quickly. We have a Get COVID-19 Facts section. We have some operational readiness tools for RCCE. So in our, SBC, RCCE operational checklist with some staff safeguarding checklist, business continuity. We have some HR budgeting tools for RCCE. So some sample job descriptions, mental health and psychosocial support guidance for staff. There's a sample implementation cost plan with cost implications that IFRC has shared that'll be available. We'll have some information on coordination mechanisms. So where those coordination structures are globally, regionally, and nationally, and how NGOs can plug into them. We'll have some rapid behavioral assessment tools and surveys available specifically for COVID-19. We will have some RCCE strategy development tools. Some have been developed at the global level. We have some other optional tools that will be available, like a behavioral prioritization matrix, There's some global level guidance on including marginalized and vulnerable populations in your RCCE efforts. We plan to have links to existing messages for COVID-19, some sample messaging guides. We'll have also some tools and fact sheets around core principles for messaging and adaptations, so some simple do's and don'ts for messaging, and then some pre-testing templates. As well, Carla mentioned this too, we have some community engagement tools. So there's guidance, there's some guidance that have been developed already at the global level. There's some that are under development right now at the global level that will be shared. And then READY has developed some community engagement tools that will include some of that guidance around interactive radio programming, WhatsApp, and social media, and so on, in terms of remote engagement. So we will also, we have some basic M&E framework guidance for our CCE. We are also including with that some sample indicators that will be useful for our CCE for COVID-19. So that will be available on the READY Knowledge Management Hub. I do want to say that we are also developing Compass modules. So those will be available soon as well, but this will be available in the immediate future, like within the next few days, and we'll be sure to send those links out to you, and it will be continuously populated and updated as new guidance comes in. But as well, you know, we will have those Compass modules available as well on that Compass platform. That will probably be within the next couple or 2 to 3 weeks. Oh, sorry, there was also some key considerations that we'll include there as well around rumors, stigma, quarantine, gender, mental health, psychosocial support, and some of the technical areas that you all work in. And I would be relying on you to really help kind of populate those areas, particularly as it relates to risk communication and community engagement. So whatever sort of messaging and behavior change approaches would be included there. So I will end there. Sorry, I know it's a bit long and it was a lot of content, but Carla and I now will be available for any questions that you may have.
Thank you very much, Catherine and Carla. That was an excellent run through of what is clearly, just going by participation here, something that is hot on every moment. So yeah, without further ado, open to questions. We'll do what we normally do on collective calls. The first person to shout out, go for it. And then if you've got further questions, add them in the chat box and we'll come to them as we go. We'll try and clear as many as we can, but I think if we don't get through every question, then I think we can try and capture them and maybe give some emailed responses later down the line. So yeah, please, over to you guys. First question, shout out.
Hi, this is Jeremiah. Can you hear me?
Yep, please go for it, Jeremiah.
Okay, well, I had already posted the question on the chat box, but I will just go with it. Thanks for the presentation. But one of the concerns I may have is actually the community engagement in an area where you don't have the phone, telephone and internet network, and even radio communication. Actually, radios also do not exist, and this is mostly in the low developed countries. And with the lockdown, how would you actually employ such a community engagement approach? And at the same time, note that some of these countries, people have low perception of the government, so you may not be in a position to use the government network as well. Thank you.
Yeah, that is quite a challenge. So one thing that I just want to say, just off the bat, so I don't know the implications of this yet, but I am under the understanding that WHO is trying to implement some sort of free internet access that can be downloaded. So there's some program that they're trying to push out. So I will let you know what I hear about that later on when I get a little bit more information about this. I was only informed about this late last night, and it was uncertain. A lot of the details around that were really unclear, but that could be a potential option. I'd like to kind of turn it to Ansha. I see Ansha is also on the line here, and Carla, to see if you have any suggestions around that. But I will say that, again, this is sort of a new area, this whole process of remote engagement in a pandemic, in a social distancing situation. And so, there's been a lot of conversations on the use of technology, but I'm glad you're bringing this up around some of those really difficult areas where you may not have access to those technologies. And we're really going to have to think through how we're going to do that.
Sure.
Yeah, go ahead.
This is Antje. Hi, everyone. Antje Becker-Benton, Save the Children US. I'm the team lead for behavior change and community health, and Carla is part of my team. We've been thinking through how to continue community engagement through digital and mobile media for a while, also in collaboration with CCP on the Breakthrough Action activities, which is another global project. And I think the primary idea is twofold. One, I'm working even with Somalis in the north of Kenya, and many of them have phones. So mobile phones have distributed much faster than sometimes even radio access, because mobile money is available through phones. And so this is a bit of a lifeline, because organizations such Viamo have platforms that are demand-based, where people can call in for free to get information, for example, and can distribute that then. So there is a bit of a cascading idea that community leaders could, because among community leads, often someone has one phone and then is responsible to cascade and distribute information further into communities. This kind of scenario can be prepared, in the countries that have, let's say, a week or 10 days lead time into more severe stages of the pandemic. And so programmers could work with community leaders to collect phone numbers to set up these kind of cascades, for example, and then see if they can program through. So it would be good to have some examples of the specific countries that you're talking about and the communities. There's always some that are really, really hard to reach, but we've been at Save the Children working a lot with these very hard to reach regions and populations, and we do have some ideas. I'm keeping it there, so I'm keeping it short. Back to Catherine.
Thanks, Ansha.
Thanks for that. Actually, I forgot to mention that I'm Jeremiah Kariuki from Save UK, working with the EHU. There are some countries actually where you, as you mentioned, like in Kenya, you have some areas that you do have mobile network, but again, it may not be that strong, or actually some areas they have no network. I would also mention some other countries that I've been into, like DRC, where I was recently, and I know in some areas we are really struggling when doing the Ebola response because the network was either not there or it's so very weak. So there are a number of countries that can be given as examples for that.
Yeah. So with nomads, for example, up in the Somali border, there's a community radio station that regularly goes into the media dark areas and does outreach. So with social distancing, it could still be arranged that you work with the radio stations, and especially community radio stations, to do that type of outreach following the usual social distancing guidelines. But those are new things, so we need to discuss more. But I wanted to make space for more questions.
And maybe I just want to say that, Jeremiah, I will take your concerns up to the global RCCE working group subgroup around this when we're developing guidelines around this, because I think it's really important. I think it'll come up from other people as well, but I'll make sure that this is going to be addressed.
Thank you.
Catherine, I have a question. This is Nicholas.
Yes, please.
Yeah, this is Nicholas. I work with the Emergency Health Unit, SUK. My question concerning RCC will be the issue of now the health workers themselves, whether they're experts or national staffs, being attacked by the population or being attacked by the let me say special groups like religious groups or maybe the local administration, like what happened in DRC. I'm sure Jeremiah, having been one of the team leaders in Beni, this one occurred quite a number of occasions to some of the partners who are working for the Ebola eradication in North Kivu. So how do we package this one from the beginning? How do we get hold of these rumors against the health workers? Probably maybe doing something like an intervention for coronavirus, maybe in future.
Yeah, that's a really good question. So I didn't really touch on the issue of, potential conflict. But, we do see that happening in different emergencies. And so it is an area of concern. The idea of, making sure that we are building trust from, a very early stage, and we're building relationships with those communities is really going to mitigate, the conflict that may result later when or if things get really challenging, particularly if there's a lack of supplies at the community level, if there's a lack of real understanding of the changing environment that's being created by COVID. And so, we can take a lot of the lessons learned from DRC and apply them here. All I really want to say to that is making sure that we are, again, building trust with those communities early on, responding to those rumors and misinformation early on. There are, again, risk communication and community engagement mechanisms now in many regions and in many countries. And a lot of those are focusing on rumors and miscommunication or misinformation, excuse me, and importantly, disinformation. So that intentional disinformation that is also circulating. And so they're making sure that we as organizations are feeding into that, so that if we're, hearing different rumors, that we're feeding into those mechanisms, that we're amplifying, the power of the organizations that are addressing those rumors, I think will be really important.
I just wanted to add, hi, this is Carla. I just wanted to add that, yes, this building relationships and trust with the communities, that's why this is so extremely important. But also important is to keep in mind why two-way communication is also really essential for this response, because there are going to be rumors, like Catherine has mentioned, and there's going to be misinformation, and it's good to have this opportunity for communities to kind of to voice this misinformation, but also voice their concerns, their issues, and their fears, because, we need to listen to their fears to be able to kind of more closely work with them, I think. Yeah. Right.
Thank you. Yeah, that's fine.
Thanks,
Hello?
everybody. Just we've got maybe 10 minutes left. Are there any questions from technical or operational colleagues in any of the East and Southern Africa countries around this?
Hello? It's a comment.
Yes.
Hello? This is
Yeah, hello,
Yvonne.
that is on. Yeah, please,
Yeah.
Yvonne, go for it.
I mean, we've seen government tactics. Hello? Sorry, I lost you all. Am I still online?
Yeah, we can hear you.
Yeah, maybe as well, Yvonne.
Yeah, I'm just saying, I mean, in addressing this pandemic, we've seen tactics by various governments change from soft to hard. And so far, but I guess an evaluation will be done several weeks or months down the line. We'll see which tactics have been the most effective. But so far, it seems like, you know, the hard tactics are winning out here. Like in Kenya yesterday, there were more restrictive measures put in place by the government and the like, you know, just legislating things. So we are still, as an organization, in the soft space, you know, behavior change or trying, you know, but what's our value add in a space that's getting more hard, you know, where government has to now restrict people's freedoms? For an organization that places, you know, the value of human rights so highly, what space do we play in that arena, especially now that it's seeming like those kind of tactics are the more effective in dealing with a pandemic such as the one we face?
Well, if I understand your question, I think it's more necessary than ever that you're playing a role here at the community level, because there needs to be, you're in the communities, you have access to those community members at all different levels and in all different parts of the country, in those hard to reach areas, as was just talked about. And so, you know, there may be some guidelines that are coming down from the government level, but ensuring that those community members are able to respond to those measures and are able to do so in a way that is feasible for them and that makes sense to them within the context of their own culture is going to be really critical, because when we don't do that, we'll really see the conflict that we were just talking about, and we'll see a lot of the rumors and misinformation and so on. And so I would say there's a greater need than ever to really play a role. I don't know if any of my colleagues want to.
Yeah, it's just that our role is also hampered by the fact that sometimes our access is limited. Because of these restrictions, we are also being asked to stay put. So yes, there's an assumption there that our continued role in the communities, but sometimes that's diminished by these restrictions that the government is placing on us.
I see what you're saying.
So this is Antje. I wanted to, you know, add maybe the example of Uganda, where I'm, you know, part of a group, a WhatsApp group of all the SPC practitioners in the country that has formed a while ago, quite some time ago, but they're exchanging very actively at the moment, you know, what the new regulations are, what can be done when materials are good. So they're exchanging SPC approaches, you know, or RCCE approaches and materials and news, and discussing basically action. So I think what's important is to stay in touch also with the coordination mechanisms in country, part of which is UNICEF, often in WHO, to figure out, to first of all know that, you know, there are several actors in one country trying to do the same things. We need to coordinate with each other so that we don't duplicate efforts, and also to develop more and better ideas how to work around the current, let's say, restrictions of movement, and so that we know which digital and mobile platforms are already at work, with whom we can work basically to get the word out and things like that. So I think coordination is key. Of course, we can over-coordinate ourselves also, but coordination with other RCCE actors, practitioners, and organizations active in the space is highly important. So that would be my tip for now. And we can, you know, not sure which country you're representing, but we can figure out what those linkages are offline.
Yeah, no, it's true. We've been asking our country offices because a problem such as this will need coordinated effort. So not just the individual organizations, but of course together with the government. So that's one of the things that we've been asking of country offices, you know, to truly engage in the coordination mechanisms in their respective countries, because in all likelihood, donors might, you know, it's still too early to tell, but some of them have already written to us asking, you know what, we are open to you reprogramming the current funds you have towards a national response. So there's already, you know, awareness there, you know, or rather an appetite there for funding joint responses towards this. So yeah, that's appreciated for the donors that have already, you know, started reaching out and being flexible about this.
And I think, you know, pointing out, you know, maybe Jesse, you can respond to that, or Catherine Bolle is on as well. There is a larger global group working, you know, on these situations and trying to give guidance. So we can respond to that also offline.
Thanks. Thank you.
On the SPC space, maybe I'll take, you know, a couple of minutes to just update you. This is Antje again. You know, we just to let you know that our programming guidance, the framework that was, you know, reviewed here by this group, but also sent out a couple of days ago, was actually refined over the weekend. We've, you know, there's a small group for a programming group that's part of the Save the Children COVID-19 task force, global task force, and we've been refining this framework, including the SPC sections. And so this will come out very soon. It's quite, you know, it's complementary to what Catherine and Carola have been presenting, and dovetails and complements each other. We're also working on a collection of resources, but have been sending around a link that's important for everybody, which is a link to the Compass resource collection on SPC resources that Catherine Bertram has been spearheading over at CCP with their knowledge management team. And there's a lot of very useful materials there. And so we will be sending that one around again. We also have a global technical working group on social and behavior change, which is led by me and Paula Valentine from SCOK. And right after this, we'll have a phone call together to start this global working group up and to see what role we can play in the response. In the meantime, while we're basically trying to figure out how to define maybe focal points for technical support, I wanted to guide you to our Facebook at Work page. It's called Behavior Change and Community Health. We've been posting useful materials, links, and SPC guidance and RCCE guidance therefore during the last couple of weeks. Please sign up for that. We also have a listserv called Behavior Change and Community Health. If you would like to be signed up, please let Carla Sanchez at savechildren.org know that you would like to be part of that. That's just my little update on the SPC side here at Save the Children.
Thank you very much, and thank you all for taking the time. We've got a couple of minutes left. I think the key thing here, at least my takeaways from the presentations and from this discussion, is that we've got a lot of interest, an immense amount of interest, which demonstrates an immense amount of awareness on the importance that this plays in what we need to try and do over the next few weeks and months. I would urge and stress everyone on the line who's coming from one of the countries in East and Southern Africa to not wait for information to come down, right? This will succeed if you show the interest, right? There's already some bilateral conversations taking place between myself and Rwanda office, between a couple of others, and that's spearheaded at a country level. We don't expect you to have all the answers. As you said, a lot of the issues don't have answers to them yet. But we can work them out together, and that advice will come down the line to you. But there needs to be the intent, the desire, the drive, the hunger for doing this at a country level. So if you can think through your specific issues, your specific challenges, be them in an operational context, be them in a more technical gap analysis, etc., and then reach out, we can help provide and think through some of those solutions with you. But if you sit back and wait, then it's probably not going to come along as quickly as it should do. So please, 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 my plea would be for you to pick this up at a country level and to drive this. We have maybe 1 minute left. If there's any final remarks, anything closing from Catherine or Mike at the Ready team?
None from me, just to say thanks everybody for tuning in. I think it's a really opportune time to convene and get around this really important issue. And hopefully this, as Tom mentions, this discussion doesn't end here. And we can keep that community of practice piece going forward to share different approaches. Please do use this as a resource, and we'll be sharing some of those resources around after this call. Thanks.
Yeah, hi, and just maybe one thing for me. This is Catherine.
For Catherine.
We will share the presentation, and I'll share with you some contact information so that you can, ask any questions that you may have afterward to me, to Carla. We'll be happy to help you.
Great, thank you very much. And we are also engaged at a regional level on the RCCE working groups, and there's a lot of conversation there around this stuff, which is all tying into the same conversations. So I said, please do reach out to those who have been speaking today, to myself, to help signpost you to the right forums, and we can hopefully try and move this forward at a country level. Awful lot to think about on top of a lot of stuff you're already thinking about, but please let's engage on this subject matter at a country level as detailed and as in depth as we can, and hopefully we can move something forward that becomes the best practice, examples of best practice elsewhere. Thanks everybody, we're at time. Enjoy the rest of your days, and we will no doubt be speaking again very soon.